Hi, my name is Shirley Gutkowski. I'm a dental hygienist and I'm speaking to you today from my home office. I'd like to talk a little bit about diabetes today. You may have seen some of my articles on diabetes self-management if you already have diabetes or if you're interested in that kind of thing. There's a couple of things that you need to know if you have diabetes with respect to oral care. For one thing, if you're not managing your blood glucose, you're also having a higher concentration of sugar in your saliva. And of course, that sugar in your saliva is feeding the bacteria that cause your teeth to kind of break down and get cavities. So it's real important that you maintain your A1C numbers. The second thing is your susceptibility to periodontal disease. Periodontal disease is an infection around the supporting structures of your tooth, namely the gums. People will also say that it affects the bone, but really the bacteria that's around your teeth eventually causes the bone to disappear because of the body chemistry that's set up once there's an inflammatory response. There's a bunch of chemicals that come about when you have an infection in your mouth, like a periodontal infection. One of those is C-reactive protein, and that C-reactive protein is an indicator of inflammation. It is a better indicator than cholesterol whether or not you're going to have a heart attack, and it is also interfering with the body's ability to heal the blood vessels. So now think this through with me for just a second, because you're going to have to remind your dental hygienist about this. If your A1C is high, if you have high C-reactive protein numbers because you have an oral infection or an infection anywhere else in the body, or if you have an inflammatory disease like arthritis or adipose tissue, and all of that kind of thing really helps to increase the C-reactive protein number. So it doesn't only come from periodontal disease. But if you have a high C-reactive protein number and they're doing their little measurements around your teeth, your microvasculature, the little tiny blood vessels that are around your teeth, are highly susceptible to bleeding by any tiny amount of provocation. So using a bleeding on probing kind of an indicator for periodontal disease is not a real good indicator. So to get kind of back around here, if you have diabetes and you're not managing your blood glucose very well, the bacteria that are in those pockets in the area between your tooth and your gums, that gets fed too. So it's real important that you keep that bacteria load down. And the easiest way to do that, of course, is brush and floss. We're never going to get done talking about brushing and flossing. But the other thing that this insurance company found is that by treating a periodontal infection, the people with diabetes and medical insurance in this study from this insurance company found that the people had $2,000 less per year in medical expenses per person. So if person A has diabetes and person B has diabetes, they both have gum disease, one has it treated, one doesn't. The person who had their gum disease treated by a dental hygienist had $2,000 less in medical expenses than the person who didn't. So a dental hygienist is a really important part of your care team. And somehow, I don't know, just doesn't get to the top of the pile. So please make an appointment with your dental hygienist if you have diabetes, and make sure that they know that you have diabetes and that you're trying to keep from getting sicker, and you're going to enlist them in your system. So my name is Shirley Gutkowski. If you'd like more information or you'd like to contact me for patient advocacy, I'd be thrilled to help you. You can find me just about any place on the internet. You can search Shirley Gutkowski, Gutkowski, and I'd be happy to help you. Bye.